Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today, once again, is Margie Prop. Thank you so much, Margie, for being here. And thank you to everyone for joining us to learn about the latest local developments. I also want to acknowledge and thank two members of our local Board of Health who are here with us today, City Council Chair James Michael Bowers and County Commissioner Sean Flowerday. We are here today to remind everyone that we live in a community that likes to win. We like to win at sports. We like to win at business competitions. We like to win academic prizes. We like to win spots on American City Top 10 lists. We like to win, and we do win, often. Until recently, we were winning the pandemic race between injections and infections. Back in May, through our community's teamwork, we moved Lincoln and Lancaster County's risk level into the green on the risk dial. You could almost hear the collective cheer as we got back to the business of summer, enjoying time together at concerts, in restaurants, at graduations, weddings, and other celebrations with family and friends. For a brief moment, we enjoyed a victory lap. Now, a new opponent known as the Delta variant of COVID-19 has entered the race and is making gains, as evidenced by the strain on our hospitals and the unwelcome trends in other indicators that our health team has been monitoring and measuring throughout the pandemic. You may be thinking, I'm already vaccinated and therefore protected. Why should I be concerned? To all who are vaccinated, we give our deepest thanks. You have taken the most important step to protect yourself, your loved ones, and our community. If you are vaccinated, you are more protected and less likely to experience the most severe outcomes of COVID-19 should you still manage to contract the disease. That said, all of us who are vaccinated still have cause for concern. Unfortunately, despite Lancaster County having the highest vaccination rate in the state, enough of our residents remain unvaccinated, either because they are not yet eligible or because they are hesitant, that the Delta variant is getting a foothold and impacting our entire community. Locally, we are on the upward spiral of a surge of the Delta variant. The uncontrolled spread of the Delta variant is leading to more quarantines and illness, making it harder to keep all of our children in school or in childcare, and making it harder for parents to report to work. The uncontrolled spread is leading to increased hospitalizations that threaten everyone's ability to access emergency care. Our hospitals are currently burdened by COVID cases, and unless we do more to stop the spread, the situation in our hospitals will only grow worse. Too much is at stake for all of us, whether or not we are currently vaccinated. Too much is at stake to stand by and let this continue. We cannot afford to let the Delta variant win. We will not let the Delta variant win. Health Director Pat Lopez, our local hospital, medical, and Board of Health leaders, and I stand here today to say that now is not the time to be scared. It's the time to be strong. Our community needs you. We need you to use the strength and power that each of you have to help us beat the Delta variant. The most important thing that would help is for those who are eligible but not yet vaccinated to go get vaccinated, just as millions of Americans and nearly 200,000 members of our community have done. Vaccination is truly both an act of self-protection and community service. The FDA gave full approval to the Pfizer vaccine yesterday, which is great news, and should give more people more comfort as they roll up their sleeves. If you still have questions about vaccines, please consult your medical care provider or get the latest information available at our website, covid19.lincoln.ne.gov. If you are already vaccinated, we need your help too. Even if you are fully vaccinated, we need you to take further steps to slow the spread and reduce the impact of this surge of the Delta variant. We know now that vaccinated individuals can transmit the variant, so our community needs you to mask up. We need you to mask up to help ensure that there's an ICU bed available if you or someone you love suffers a heart attack or gets in a car accident. We need you to mask up to help protect our children who are not yet eligible for the vaccine. And we need you to mask up in part to give our healthcare providers a break, because they are at their breaking point. As for the rest of us, we are at an inflection point. This most recent surge in cases, hospitalizations, and deaths affects everyone, vaccinated and unvaccinated alike. The choices we make today directly influence the ability of the Delta variant to spread and consequently the number of cases and hospitalizations we will see in the coming weeks. The actions we take today as a community to slow the spread of this virus, guard our hospital capacity, protect those unable to be vaccinated, and keep our economy thriving matter. The next few weeks are critical. Good news is, we can do this. We are a community that likes to win, and together we will beat the Delta variant. Here now, with more information about how we will do that, is Health Director Pat Lopez.
Thank you, Mayor. The Delta variant's hitting people faster and harder, as we've said before. It's causing more people to get sick and more severe illness, particularly among those who are unvaccinated. We don't want our community to reach the level of crisis seen elsewhere. Over the last week, our situation in Lancaster County has become critical. We are now averaging 100 new cases per day. Our Lincoln hospitals are stressed and have few beds available. Our local positivity rate is very high, meaning the Delta variant is widespread in the community. 18 members of our community have lost their lives to COVID-19 so far this month. This rapidly spreading Delta variant is increasing the risk to our community. The risk dial that was in the low orange last week is now moving to mid-orange today. We have reached another pivotal point during the pandemic where we have to take immediate action to protect our community and help stop the spread of the Delta variant. Today, we are announcing a directed health measure that will move the current indoor mask recommendation to a requirement. Let me provide some further explanation by starting with a more detailed look at our local situation. This chart shows how quickly we've seen our daily case numbers increase. The number of cases has nearly doubled since the beginning of July. Over the first 3 weeks of August, our 7-day rolling average of new daily cases has risen from 56 to 108. We've had outbreaks in 18 different child care centers since July 1st, and 7 have had to close temporarily to stop the outbreak. 14 long-term care facilities have reported COVID-19 cases in the last 2 weeks. That's close to a third of the 51 long-term care facilities in Lancaster County. This is very concerning because prior to July, we were rarely seeing cases in long-term care. Since the second week in August, we've had 249 COVID-19 cases in school-aged children. We've confirmed 1 outbreak and are investigating the possibility of more. Increased cases are leading to increased hospitalizations. The 7-day rolling average of local COVID-19 hospitalizations was at just 13 at the beginning of July, and at the end of last week it was 78. Today, the hospitals are reporting 75 hospitalizations with 12 people on ventilators, and 55 of them are from Lancaster County and 20 from surrounding communities. Our Lincoln hospitals are stressed and few beds are available. Emergency rooms are extremely busy. Our hospital partners tell us that the majority of patients currently hospitalized are unvaccinated, and that many of the cases they're seeing are very preventable. Sadly, we've seen a sharp increase in COVID-19 deaths in August as well. I mentioned we've lost 18 members of our community so far this month, which includes 3 deaths reported today. This is more than we've reported over the past 3 months combined. The ages range from the 30s to the 90s. 14 of these individuals were unvaccinated. Throughout the pandemic, we've taken thoughtful, measured steps based on our data to slow the spread of the virus, prevent illness, and save lives. This strategy, along with the actions we've taken together as a community, have served us well. Vaccination continues to be our best defense against the Delta variant, but as cases, hospitalizations, and deaths keep climbing, we need to use other public health tools available to help our community keep safe, and get us through this surge. This includes wearing a mask. As I mentioned, we are restoring the local indoor mask requirement. It applies to all people age 2 and older, regardless of vaccination status. It will go into effect on Thursday, August 26th at 12:01 a.m. and continue through September 30th at 11:59 p.m. And information will be posted at covid19.lincoln.ne.gov. Wearing a mask is a common sense measure that has had strong impact. And as a community, we know masks work, not only based on science, but firsthand experience. Locally, the previous mask mandate contributed to a lower case rate and lower death rate in Lancaster County, more so than other highly populated counties in the state. The Centers for Disease Control and Prevention and numerous other experts in public health care currently recommend universal masking in schools and throughout indoor environments in the community. To slow the increasing spread of the virus, it's important that the mask requirement includes everyone, regardless of vaccination status, because of the aggressive and highly contagious Delta variant. People, both vaccinated and unvaccinated, continue to share indoor spaces where it's easy to spread COVID-19. Today, we have our local hospital administrators here with us to tell us what's happening in their situation, their current capacity, as the number of COVID-19 patients needing hospital care continues to go up. I'd like to ask Derek Vance, president of CHI Health St. Elizabeth and Nebraska Heart, to tell us about the current situation at the hospital. Derek?
Thank you, Director Lopez. It's sobering to think about 2 months ago, I was celebrating with our hospital teams that we were finally pulling out of this pandemic. After more than a year of intense strain and stress on our healthcare system, the hospitals were beginning to feel back to normal. And today, we find ourselves right back in the middle of the pandemic. The number of COVID patients at St. Elizabeth has risen exponentially in recent weeks, to the point that we've reopened and more than filled a dedicated COVID unit at the hospital. Our ER, as Director Lopez mentioned, is bursting at the seams. We are seeing record numbers of patients in recent days, and this is not cold and flu season. The single greatest stress on our ERs right now is the increasing number of COVID-related patients. Now, there are some key differences to where we are today and where we were a year ago. For example, medical supplies are not the issue that they were in our country a year ago. And of course, at CHI Health, we're part of a large organization and have access to resources and supplies both regionally and nationally. We also have the vaccines today, something that we didn't have a year ago. And this is a huge help and a huge difference over where we were before. The vaccines are keeping the vast majority well protected and at less risk. Yesterday's FDA approval of the Pfizer vaccine further indicated what we already knew. The vaccine is our best and most effective measure that we can take when it comes to preventing further spread of the virus. My primary concern is what the coming days and weeks look like for our hospitals. If we continue to increase at the current rate with COVID patients in our hospitals, we won't have beds for trauma patients, surgical patients, cardiac patients, so many other resources that require our hospital. When it comes to masks, they of course have never gone away in our hospitals. Everyone who sets foot in our facilities is required to wear a mask while they're there. Administration, staff, volunteers, patients, visitors, physicians, all are required to wear masks in our facilities. This is because we believe in the science of masks, and we know that they are a key tool in stopping the spread of COVID. While we're all tired and fatigued, we need to continue to take steps to keep each other safe. Masking up, socially distancing, washing your hands, staying home if you're sick, and getting vaccinated. I strongly support the reinstatement of this directed health measure and appreciate Director Lopez, Mayor Gaylor Baird, and their courageous decision to do so and to keep our community safe. I'm grateful to be accompanied by Russ Grunwald, CEO of Bryan Health, and I'll turn the podium over to Russ.
Thank you, Derek. Thank you, Mayor, and thank you, Director, for having us out today. One of the last times that I was here was in the middle of the winter surge at a really desperate point. And thank you to all of you who stepped up and did what was asked, which was to mask and distance and do all of the things that we asked of you, and eventually get the vaccine, because it made all the difference. It allowed us to get through it at that time. So the question, I think, is, are we simply in a rerun of last winter? And the answer is not yet, but we're on our way there. Let me give you just a little bit of context. Bryan's physical capacity and our staff capacity, we plan for about 500 patients in our inpatient units every single day. A lot more on our outpatient side, but about 500. And then our plan is to be able to surge every day, if we need to up to about 540. So we do that with extra shifts and overtime. We do that with traveling nurses if we need to. But nevertheless, we can go up to about that 540 number, and we plan on being able to do that at some point every week, a lot of times in the middle of the week, but certainly not on the weekends, not on Mondays. Last week we had this big bump all of a sudden, and we were at 579. And that was way beyond anything that we had seen since I had ever been at Bryan. And what does that do? Well, we also take care of about 250 emergency or trauma patients every day in our 2 hospitals. And so what that does is it backs everything up into our emergency rooms, and there are many people there waiting for a bed. And that means we're not taking care of the folks that need to come through because of their emergencies and trauma. That means that of the 52 communities or so that we serve out across greater Nebraska, if they try to transfer, we can't take care of all of those. And in fact, we started diverting last week during that time. And I talked to one CEO of a small community who sends a lot of patients our direction because of our trauma center and our heart program. And he had an accident in their local community. Wanted to send it up, called, and we said we couldn't take them. And he said it wasn't just Bryan. When I spoke with him later, it was every ICU at a major hospital in Nebraska. Every ICU bed was full. Nobody could take him, and that patient ended up needing to go to Des Moines, Iowa, because no Nebraska hospital could take that patient. And unfortunately, that patient had a tragic outcome because of that. That can't happen. So we immediately reduced our non-emergent surgeries, and we bought ourselves some time, and we got down to below 500 just temporarily. Yet I'll tell you, this morning we were at 545, beyond the capacity that we even plan to surge to typically. So what are we doing about that? Well, we've also are opening up isolation units, where we opened up our 5th, I believe it was our 5th isolation unit yesterday. That means that our staff is heading back in there rather than taking care of patients as they normally do. You've seen the pictures. We put them in the PAPR suits. They go behind the doors. Nobody else comes in, and they feel very isolated, let alone the families of the patients, let alone the patients. And that's kind of where we're back to, and we're planning on, again, opening more in the future unless something happens very quickly. It's difficult for patients, family, and staff. They feel, as you know, and you've heard them say before, they feel isolated, they feel tired, they feel very frustrated that we're in this situation. But like good Nebraskans, they put their heads down, they put their mission hat on, and they go in there every day without complaining. But I'll tell you the thing that really has them frustrated right now. It's 22 deaths in 2 weeks. 22 deaths in 2 weeks, some of those from outside, but most of those in Lancaster County, some from outside Lancaster County. That's hard for them to go every day, hold the hands in the isolation units, and watch people who shouldn't be there passing because of COVID. So what does this action do? Well, we're very supportive of this action. Along with the reduction in non-urgent surgeries that we've taken on, and that can't go on forever. Those folks need care, but we're able to delay it for a while. But along with that reduction in non-urgent surgeries, this action is going to hopefully help us free capacity for those emergency room and trauma cases that we know we need to take care of. That's why we're here. Second, we know that this does exactly what we've always said it does. We know that vaccines work. We know that masks work. Now, I also know, I've spoken to a lot of people, like many of you have. I don't think that a CEO of a health system standing up here today is going to convert somebody from being a non-vaccine person to a vaccine proponent all of a sudden. But again, we know that masks work. And we know that that's something that all of us can do. We know that this is different. We know that the Delta variant is affecting younger people. In fact, now we're seeing whole families coming in to be tested because whole families are experiencing symptoms. How about young kids? Why do they need it? They're not in that much danger. Well, yes, they are in more danger than they were, but they're affecting the rest of the family. And as Director Lopez said before, we're having deaths even among people in the 30s. In fact, of the 61 currently positive patients, we have more that are post-positive patients that came in as COVID patients. But of the 61 currently positive in our hospital, 11 of them are under 40. And they're in general care, they're in ICU care, they're throughout, and some of them aren't in the best shape. So here's what we're asking of you. The easiest hard decision is the one that saves lives. The easiest hard decision is the one that saves lives. Masking is not too much, I think, to ask to make sure that we're all protected. And we need to be there when you need us most, and this is one of the ways that we can make sure that that's happened. Thank you.
Thank you, Russ and Derek. We appreciate your commitment to caring for people in our community and your support. Our partnership has served our community well. And speaking of partnership, also joining us today by Zoom is Dr. Eric Avery. Dr. Avery is president of the Lancaster County Medical Society, and he's going to share some additional perspective from the medical community. Dr. Avery?
Thank you, Pat, and thank you, Mayor, and the Health Department, and Derek and Russ.
On mute.
Nope, I'm on. Can you still not hear me? I'm on.
Whoops.
Can you hear me now?
Okay, Dr. Avery, I think we had a little technical blip.
Okay, can you hear me now?
Nope.
Nope. I'm on my side, I'm sorry.
You're good. We got you now. Thank you.
Oh, okay. All right. Thank you all for all the comments, and thank you for having me here. Again, as president of the Lancaster County Medical Society and the hundreds of physicians here in Lincoln and Lancaster County that we represent, we also fully support the decision today to protect our community, to protect our neighbors, our loved ones with the mask requirements that that are in place. The medical community has continued to beg people to get vaccinated, to wear their masks, and to protect each other. And it's hard. I mean, no one wants to be wearing masks. No one wants to be doing this a year and a half into it, and we're all tired of it. And we get it, but we also still have to take care of each other. We still have to make sure that we're doing the right thing. Unfortunately, people in Lincoln are still dying from COVID. Many of these are preventable deaths. Young, healthy people without medical problems are having tragic outcomes from this. And and there's so much more that we can do. You know, wearing a mask, it decreases the spread of the virus. It helps save lives. It keeps people healthy. Getting vaccinated, decreases the spread of this virus. This virus, yeah, it's probably going to be around for a long, long time, but having the immunity, having people get the vaccination, and right now protecting ourselves is the way to really help us get back to our normal lives. Even if you're vaccinated, though, you should still wear a mask. They help a lot. Yeah, nothing's perfect. Nothing in medicine is perfect, but you don't know the person next to you standing at the gas station, you don't know if they're immunocompromised. You don't know what's going to happen to them if you happen to pass something along, or vice versa. We have to protect each other and work together. By doing this, it's our best chance to calm down this current problem, get the numbers back down, hopefully be able to kind of get back to life in general again. If you have questions about the vaccines, ask your doctor. Don't go on Facebook. Don't go on any random website. Talk to your doctor. Talk to people who have trained their entire lives for this. This is what we do. Vaccinations are safe. They're effective. They save lives. And wearing masks gives another layer of protection for that. Masks are safe. They're effective. They help. We have lots of things that we can do to help each other. We just need to keep doing it. And I just really appreciate the health department kind of stepping forward and protecting our community this way. The data from the first go around with all of this shows that we have absolutely saved more lives by doing these measures. And it's really important to continue to take care of each other. So thank you again, and please be safe.
Thank you, Dr. Avery. We value the continued support and assistance from the physicians and the medical society. Our current situation is critical, and we can help change the course of this pandemic by collectively adjusting our behavior. I thank all of our residents, our businesses, and our schools for understanding that reinstatement of the mask requirement is a necessary and immediate step we must take to protect our community. We continue to strongly urge all those eligible to get vaccinated. As you've heard, vaccination offers a high level of protection against severe illness, hospitalization, and death, and it helps stop further spread, which can lead to more variants. We just hit a milestone in vaccinations. As of yesterday, 70% of our population aged 16 and older is fully vaccinated, and we expect that number to continue to rise based on the upward trend in vaccinations. Nearly 25,000 Lancaster County residents received vaccination over the past 8 weeks. That reflects an increase of nearly 70% since the beginning of July. This is very promising, as many of these people were initiating vaccination and getting their first dose. Every person vaccinated creates needed protection for our community. As the mayor mentioned yesterday, Pfizer's COVID-19 vaccine for people 16 years and older has received full and final approval from the Food and Drug Administration. We know some people have been waiting for this step before getting vaccinated. If that's you, please get your vaccine now and join the almost 180,000 members of our community who have already rolled up their sleeves and are now fully vaccinated. We all contribute to the health and safety of our community, and getting vaccinated and wearing a mask creates that needed protection to help us get through this surge. You can find upcoming vaccination clinics at covid19.lincoln.ne.gov or by calling us at 402-441-8006. You can also find a local pharmacy offering a vaccination at vaccines.gov or by texting your zip code to 438829. And with that, we'd be happy to take any questions.
Director Lopez, we have a question from Andrew. He asked, how will this affect crowded outdoor events such as high school and high school football games and tailgating, farmers market, etc.?
We have some guidance on our website. If I heard you right, Kevin, you were cutting up a little bit. But We are encouraging people to wear a mask in crowded outdoor spaces. We're not requiring it, but people should be wearing a mask when they're in a crowded outdoor space and watching their distance. That same thing applies, but in the outdoors, you have more chance to move more freely. We've also given information about how you can safely go about activities outside on the website.
Hi, Matt over at the Journal-Star.
Hi, Matt.
Hi. So I'm assuming that this, the mask mandate applies to indoor sporting events, including those from UNL?
This applies to all indoor events in Lancaster County.
Gotcha. So people will have to wear masks, say at Nebraska volleyball games,
Yes,
at high school volleyball games, anything that's indoors.
correct.
Gotcha. Is the timing of this at all related to that? The fact that we have those kinds of events starting up and people are going to be gathering?
No, I think we were trying to make it clear it's really based on what's happening in our community. All of the things that are happening with what we know, vaccinated people becoming ill with Delta and having the ability to spread that, our increased case numbers at over 108 a day, the number of deaths. I think you all saw that Brian reported 6 deaths on the weekend alone in one day. 3 of those were from our community and 3 from surrounding communities. We reported more deaths today, and also our positivity rate. So those are the things that are guiding us in this decision.
Gotcha. And then I wanted to ask, what do you say to people who feel like they've done everything right? They've gotten vaccinated, they've followed the guidance, and now here we are again, and they're having to wear masks everywhere.
I think what I say is, like the mayor said, we strive to be number one here in our community. This variant that's appeared and since the middle of July has really created havoc for both those vaccinated and unvaccinated. The individuals that are vaccinated have less serious illness and generally aren't hospitalized. We all feel that way, that we've done everything that's been asked, but we need to take this extra step right now to get our surge to stop and flatten and go down. And we don't anticipate that that's going to be a long period of time from what we're seeing nationally and internationally.
Gotcha. So I guess your feeling is that within a few weeks, we'll start to see some of the declines that they've seen in places like Missouri, where they had earlier surges.
I'm not going to say a few weeks, Matt, but we do anticipate that it will be a short period of time when we see that happen. And you're right, looking at Missouri and some other places. And one thing we have an advantage of, people are getting in and getting vaccinated, those that are unvaccinated, which is going to stop the spread of the variant in the community.
Gotcha. Just one more question for you. So if this doesn't work, or if you don't see a significant decline or leveling off of cases in the next few weeks, are you considering things like capacity restrictions that we had before?
We haven't had any discussion about capacity restrictions at this point in time, but of course we're always going to look for whatever tools are available based on our community situation. But what we do know from our experience using masks is that masks do work, and they are an effective tool in our toolbox, and we anticipate that that's the only tool we will be needing at this time. But I can't predict where things are going to be, and we'll continue to follow the data and make the decisions based on that.
Okay, thank you.
Mm-hmm.
Is the September 30th cutoff for the mask mandate kind of a hard deadline, or could that be extended if things don't start looking a little bit better when it comes to cases and deaths?
We have to have another directed health measure. That one is set to expire September 30th at 11:59 p.m.
What about venues that are both indoor and outdoor, places like Memorial Stadium? Will there be masking and lines are in and out? Are there any protocol or discussions with the university yet about what game day might look like?
We'll be meeting with the university tomorrow. We talk with them on a weekly basis, and we adjust protocols just like we gave them guidance for other activities they've had recently outdoors. But we are working with them both on the indoors and the outdoors.
Has there been any kind of significant increase in cases since the Guard concert? That was with quite a few people there. Have there been any kind of increases when it comes to that case count?
No, we really haven't. We've had a couple of people mention that they attended the conference. And unfortunately, like a lot of times, we had somebody who mentioned they went, they thought maybe they were getting a sinus infection and they weren't feeling well and they went to the concert. So we're continuing to watch that really closely, and that is one of the questions, of course, we always ask where people have been. Okay. Any more questions?
We're just checking if the other were online.
Okay.
Okay, you want me to read that? Okay, how will this affect, oh, we already asked that one. How will the mask mandate be enforced?
We'll do education just like we did before. If there are situations that will arise, we'll provide education to those individuals. We're talking about education as being our first tool.
I think we got it.
Okay. Well, I wanted to thank Russ and Derek for taking time to be with us, and our Board of Health members, and both James Michael Bauer from the City Council and our Board of Health, and Sean Flowerday, County Commissioner and member of our Board of Health. Their support has been really critical for our community and demonstrates the partnership that we have and that we're all working together. So thank you for tuning in and joining us today. And please wear your mask, be safe, and get vaccinated.